So for the last 2 months, I've been digging into the United States' America First Global Health Strategy, and I've been looking at two very specific areas. One, PEPFAR, that's the US President's Emergency Plan for AIDS Relief. And I've been looking at MOUs. Those are Memorandums of Understanding. Now, I've been looking at these two areas to get a better understanding of how 30 African nations, at least 30 African nations, have signed these MOUs with the intent of receiving PEPFAR funding from the US government. The MOUs are a little different this go around under this administration, primarily because of what these countries are being asked to do in order to receive federal funds, these PEPFAR funds that traditionally they've received in the past to address things like HIV, AIDS, and tuberculosis. In many cases, these countries are being asked to provide sensitive data that they haven't been asked to provide in the past, even specimens. And what we heard from officials in Zambia, they say that the US government is asking them to provide mineral rights in exchange for PEPFAR funds. Now, the issue of mineral rights is a sensitive one. US companies that are looking to expand their AI infrastructure need precious minerals that are really abundant on the continent of Africa and various countries. So Zambia's foreign affairs minister alleges that the US government is asking for access or mineral rights provisions in their MOU with the country in exchange for PEPFAR funds. In a statement, the foreign affairs minister called the proposed provision unacceptable, and he also added this, that Zambia must have a say in how her critical minerals are used. Now, I reached out to the US State Department for a comment on this. This is what they sent back to me. A spokesperson told me that there are no critical mineral provisions in any of the America First Global Health MOUs and no plans to sunset PEPFAR. We have prioritized continuity of care through bridge funding for PEPFAR and remain committed to responsible stewardship of the program. So the MOU conversation is a tough one for some of these countries, but there are countries like South Africa where we're not sure exactly where these negotiations stand right now. And South Africa was a country that received a substantial amount of money from PEPFAR, well over $200 million to fight HIV and AIDS, even TB in the country. Over the next several days, I'm going to be dropping a series of reports looking specifically at these MOUs, the America First Global Health Strategy, and what it's meant for partner nations in the fight to improve global health. Be sure to like and follow for more.